The nation's launching a long-awaited 3-digit suicide and crisis hotline, 988, this Saturday. Kelsey McGee looked into whether Oregon and the high desert are ready to start fielding calls on this new and very important lifeline. Kelsey?
Lee, there are concerns being voiced around the country about whether organizations are ready to handle the volume of expected calls to this new, easy-to-remember number. I spoke with the supervisor of the Deschutes County crisis team and asked him if he thinks we're prepared for the debut of the 988 service. He told me it should be a seamless transition. Starting on Saturday, people seeking help in Central Oregon and nationwide will be able to call, text, or chat the 988 Suicide Crisis Lifeline. The Lifeline was created to improve access to mental health services and will be available 24 hours a day, 7 days a week. The number will be as easy to remember as 911. In most of Oregon, including the high desert, the call centers are operated by Lines for Life. It'll be available in both English and Spanish, as well as many other languages. The Lifeline is to help people who are experiencing thoughts of suicide or self-harm, substance abuse, or any other kind of behavioral health crisis. I asked Adam Goggins, a supervisor of the Deschutes County crisis team, what are the next steps after someone calls.
Veterans can actually press 1 to get connected to the veteran crisis line, or you can press 2 to get connected to a Spanish language crisis line. But after that, you'll be connected to a qualified and trained mental health professional who will talk to the individual, try to listen to the individual's needs, see what the concerns are, and really try to give them a place to figure out how can we help this individual.
Goggins says most of the calls will be able to be resolved over the phone. He explains how people are able to connect to local resources.
We actually coordinate very closely with our crisis line staff. They have a direct line to our mobile crisis team and to the Deschutes County Stabilization Center here, so that if there's a call that can't be resolved over the phone line, they have a direct line to us, and we can coordinate with them, make sure that they have the most up-to-date information about clients or people that we know, about what the local resources are, to see if we can go out and meet with the individual in the community if we need to, or to see if they can come here at the Stabilization Center to kind of help with resolving their crisis.
Until the official launch, people should call the current number for the National Suicide Prevention Lifeline. That's 1-800-273-TALK, 8255, which will still be in operation after the transition. We have more information about the 988 rollout in our online article, which you can find on the News Channel 21 app. It also has a link to KTVZ.com's Let's Talk page with local information and resources on suicide prevention. Lee, back to you.